my name is Stefany Mayden, and I'm applying for the Nurse Practitioner program at the Cox College School of Nursing. Today I'm going to be talking about how to handle a situation in which a physician asks you as a nurse practitioner to provide care which is outside of your scope of practice. During your career as a nurse practitioner, situations may arise where a collaborating physician asks you to provide skills or duties which are outside of your scope of practice. As a nurse practitioner, it is important that you understand all the legal rules and regulations governing your state's practice for a nurse practitioner. As a nurse practitioner in Missouri, you must enter into a written collaborative agreement with the physician in order to provide care. This collaborative agreement outlines all of the job duties and skills that you will be required to perform while employed with that physician, as long as they fall within the legal scope of practice for a nurse practitioner. Today I'm going to address a few situations in which a physician may ask you to provide care which may fall outside of your scope of practice, and how to handle these situations. The first thing I will talk about is prescribing. Your physician may ask you to provide or to prescribe medications which you are unfamiliar with or fall outside of your written collaborative agreement. In this situation, you must explain to your physician that you feel uncomfortable prescribing these medications to patients because you just don't have the education necessary to prescribe them. This would be unsafe for your patients. In this situation, you must let your physician know that you feel unsafe and uncomfortable prescribing these medications, but that you're willing to attend any additional training such as seminars or classes in order to better understand the medication and feel safe prescribing it. Let the physician know a date whenever you will be able to attend any of these any educational courses, and whenever you feel like you would be comfortable prescribing these medications, especially if it's a medication that your practice prescribes routinely. Another situation that may occur is that your physician may ask you to prescribe narcotics or controlled substances. As a nurse practitioner, it is within your scope of practice to provide controlled substances in schedules 2, 3, 4, and 5 to patients. However, a situation may occur in which your physician is asking you to manage long-term chronic pain for some of your patients. Let your physician know that you're willing to see these patients and address all of their needs and concerns, but that if they require pain medications for longer than 72 hours, that you will not be able to write the prescription for these medications. A nurse practitioner is legally unable to prescribe controlled substances in schedules 3, 4, and 5 for longer than 72 hours or starter doses. If your patients require medications long term, then they will have to be seen by a physician, and the physician will have to prescribe these medications. Make sure you go over these rules and regulations with your physician whenever you're first entering into your written agreement, and then again educate him as situations arise. Another situation that may arise is in reviewing and ordering of test results. It is within a nurse practitioner's scope of practice to review any test results and order new follow-up testing for patients. This is all based on your written agreement and your collaborative practice. If a physician may ask you to write an order for a test which you are unfamiliar with, it is important that you let your physician know that is a test that you do not have education on, and that you would need to perform or to go through further additional education in order to feel more comfortable in ordering that test. Some situations may arise where they ask you to read test results and order new tests for patients, especially on tests that you have not had experience with. In these situations, talk to your physician about it. Let him know you feel uncomfortable reading test results on a test that you are unfamiliar with, and let him know that you'd be willing to follow along with the physician for a few days in order to better understand these test results and how to interpret and analyze them. Make sure you're letting the physician know that you are willing to be flexible and educate yourself, but that you are unwilling to do or to read these test results or order new tests because you're worried about patient safety. Ultimately, when you're asked to perform duties that fall outside of your scope of practice as a nurse practitioner, it is up to you to let your physician know both your limitations legally and limitations as far as things that you have not been educated on. Let him know that you're willing to do what you can in order to expand your scope of practice, but there are some things that will legally fall outside of your scope of practice. Ultimately, you're accountable to the Missouri State Board of Nursing accountable to the Missouri State Board of Nursing to represent yourself to the public, your employers, and other healthcare providers accurately. It's your responsibility to make sure that all of your actions as a nurse practitioner fall within your state's legal scope of practice. Thank you, and have a good day.